everyone. We will begin in a few seconds while people are joining. All right. So everyone, thanks for joining LOINC that pays off, driving ROI, accurate mapping, and workflow optimization. My name is Jordan Leibovitz. I'm part of the marketing team here at IMO Health. Before we get started, a few housekeeping items. First off, this webinar is being recorded and will be sent to you via email later in the week. If you have any questions throughout the webinar, just type them into that questions section in the Zoom webinar console. And then once our speakers wrap up, we'll do some Q&A. Take advantage of Wendy here from Cedars-Sinai and our experts from IMO Health. So it's a good opportunity to ask them anything. And then, so today we have Wendy Sklar-Bleeker. She is the lead analyst at Cedars-Sinai. And Dana Locke, she is our director of clinical informatics at IMO Health. And Chris Nagorny, he is our client success director at IMO Health. So with all of this being said, I'm going to have you take it away, Chris.
Thanks, Joy. And thank you, everybody, for joining today. We appreciate the time. As Joy said, my name is Chris Nagorny. I am a client success director for IMO Health. I've had the pleasure of being involved with IMO Health for the last 14 years in various capacities, and also have a background in health information management and data engineering in the healthcare space. So looking forward to a great session today. Dana, I'll turn it over to you.
Sure. I'm Dana Locke. I am a lab scientist by background, specializing in microbiology. I did that full-time for several years at a large institution in Kansas City, then moved over to an EHR vendor for several years, and I've been at IMO for 3 years as a director of clinical informatics.
Thanks, Dana. And Wendy?
My name is Wendy. I am a lead application specialist with our EMR at Cedars-Sinai. I have been working with IMO and Cedars-Sinai for the last 17 years.
Thanks, Wendy, and appreciate the partnership and you joining us today. So we'll get right into it. Dana, wanted to kick it off to you. Could you introduce us to LOINC, why it's important today and how it's evolving?
Sure. So what is LOINC? It stands for Logical Observation Identifiers, Names, and Codes. It was created in 1994 by Clem McDonald, who was a medical informatics leader at the Registry Institute. And he firsthand saw that without a common vocabulary, lab records could really never be useful for interoperability. And fun fact here, if you see the little pig to the right on the screen, the unofficial mascot of LOINC is their trademark pig. So when you first read LOINC, if you don't know anything about it, you may wonder how to pronounce it. And it's like oink, like the sound a pig makes. So once the registry team put that together, the pig became their mascot, and you'll see it on their website and registry. It's kind of a fun thing they do. Another thing about, yeah, sure. Fun fact. Another thing about LOINC, they all have the same format, which makes them easy to spot in the terminology world. They're usually 4 to 5 numbers followed by a dash and an ending number. So you could compare that to maybe a barcode scanned at a grocery store. Once you scan the barcode, you have all the information you need about that certain product, and that barcode would mean the same thing at any grocery store that you scan it at. I think a lot of people on this call with the audience are familiar with the 6 axes of LOINC, so I won't go through them all in detail, but we have a nice chart here that outlines the component, the property, the time, the system, the scale, and the method. But these are really important. They matter for precision. So not just for, let's say, glucose. If you're measuring glucose in a blood at a point in time measured quantitatively, that gives you a fair representation of what's all included. And they also matter for interoperability, so we can compare apples to apples. And it also lets us be flexible. It can represent anything from LOINC is not just lab. A lot of people think LOINC and lab, but it also is really important in the imaging world and clinical surveys.
Thanks, Dana. Yeah, that's interesting to find out about the little pig icon. So it's a good fun fact today. Did not know that before our webinar. Can you talk about a little about the common pain points with missing LOINC codes and how that can impact lab orders, results, so on and so forth?
Yeah, we can. I want to talk a little bit more though about the why LOINC is important. I think we have another next slide.
Yep.
Yeah, so this is a nice word cloud that kind of outlines why LOINC is important. Number one, it enables data interoperability. It's a common language. Without it, systems can't understand each other's data, even if they're connected. It improves patient care, make sure that the test results are consistent across providers. Good example is if a patient gets labs in one hospital, they can have their results understood and acted upon in a different facility. It's really important. They're both using LOINC, they can do that. Powers public health and global surveillance. It's used by the CDC and the WHO. Really important, great example is COVID. Without LOINC, we would have a really hard time doing regional tracking for COVID areas of interest. It's required a lot of standards, right? HL7, Fire, USCDI, all the things that revolve around interop. Also, 180, I think, countries and translated into multiple languages. So that makes, you know, patients travel, patients move, data moves, it makes everything interoperable.
Okay. Moving on to the pain points.
Yeah, so when I think about pain points with using LOINC codes, the first thing that comes to mind is billing and reimbursement issues. We'll talk more about that in a minute. But for me, working in a lab for over 20 years, when you're working in the lab, you're not thinking about LOINC. You're focused on taking care of your patients. You're trying to get your work done. You're trying to balance all of the unexpected things that come through the door. The terminology on the back end isn't really on your mind. So when LOINC needs to be represented in your EHR, and especially when you're thinking about transitioning from one EHR to another EHR, getting those codes can be really tricky and labor intensive. So in those instances, you need a real world lab person to accurately speak to all of the components, not a technical analyst, but a real lab person. And they have different specialties too. So for example, you don't want a microbiologist assigning codes to hematology or blood bank or vice versa. So getting this work done correctly is often a bonus ask of the people doing the real work day to day. And also need sort of technical affinity or want to dive into the guts of an EHR, and that's not always the case. Wendy, did you see anything similar in your experience working with LOINC synergy?
Yeah, tens of thousands of codes can be very overwhelming. So resourcing on analysts to do mappings was a huge pain point, whether it was lab or through our imaging.
Thanks for sharing, Wendy. It's always nice to have kind of that real world experience and hearing it from the folks that are working with LOINC on a day-to-day basis. Dana, downstream perspective, what impacts do these broken LOINC mappings cause, and how do you see that being a challenge in healthcare?
A big challenge is billing and reimbursement issues. If you don't have the LOINC codes in place accurately, that leads to denied claims, delayed payments, audit issues, compliance issues. That's one of the biggest factors in it. And also patient safety risk. If you have a wrong test interpretation, if the wrong LOINC code is used, say we coded a urine glucose versus a blood glucose test, that could lead to misdiagnosis or inappropriate treatment. There's lots of examples we could use there. Another big one is providers will likely be repeating tests unnecessarily. And so they could miss important results. Patients are paying unnecessarily for repeated tests, and you're just wasting time and resources and putting patients at risk. Those are the big two in my mind. Can also think about failed data exchange. If they're inaccurate or inconsistent, breaks interoperability. Well, these are all things to consider with missing LOINC codes. Wendy, do you have similar issues in your experience?
Yeah, with the implementation of a new LIS system, we needed to get everything LOINC mapped, as well as dealing with several reference labs. And as you mentioned before, data exchange with other organizations, which we do with many other organizations, having LOINC mappings, not just for our lab, but our imaging. Also, we use this service to map SNOMED concepts, which we haven't talked about, to our organism mappings for the same LIS implementation for infection control. So we have found that by doing that, using the service or the tool, it cut down our analysts' time and trying to, again, dissect tens of thousands of LOINC codes into a matter of weeks of a shared partnership with IMO on the results of the initial mapping to get to the end goal.
Thank you for that. And I'd like to echo too, the organism mapping, that's something we're really excited about. It's something new that we've started doing, but it's pretty straightforward. Organisms are going to be the same list of organisms across the country, and getting them squared away to the right SNOMED code is something that we took seriously, and we've got that base now, and we're really excited to offer that.
Yeah, we were really excited you were able to do that for us.
Yes, and also those organism mappings for anyone that on the call that's interested, that they break down the organisms not only into the organism themselves, but they also get down into the resistance markers, right? So you could have a carbapenemase resistant Klebsiella. It gets down into all the variations of the organism, which is really important for surveillance tracking. Wendy, do you have any thoughts on, do we want to talk about reference laboratories?
Yeah, for a really long time, we didn't track or map LOINC within our system because of the inconsistencies with the reference labs. But as the standardization is to move to LOINC, we've found more consistency with that area. And by having those lab orders and result components all mapped to LOINC, it helps facilitate a lot of other points within our EHR, either in reporting or quality care or just mapping for, again, data sharing.
That's good to hear. IMO does a very good job of keeping up to date with lab compendium across the industry. We've got a really good close pulse on how reference labs are always different. It's not the same across different reference labs. So it's good that we have a close communication with them on how they're each coding their own tests differently.
All right, thank you, Dana and Andy. Kind of walk us through that. I think now I'd like to kind of transition into how IMO is best positioned to help with some of these pain points and how we can do that through IMO core procedure. So I will give that a quick intro. As Dana will get into it, we have numerous experts and SMEs in the industry working on this content on a day in and day out basis, working to support customers like Wendy and her team, as well as all of our other customers and partners. We take each of these clinical terms, concepts, and we map them to relevant and standardized code systems in an effort to help solve some of these pain points. So it's something that we're very proud of, and we're excited to have Wendy join us here and be sharing her experience on IMO core procedure, and then Dana to talk through how IMO's best positioned to support this problem. Dana, can I pitch it to you for kind of talking through our clinical experience and expertise? I think you might be muted.
Oh yeah, Dana, you're on mute.
I'm so sorry. All right, so IMO has the expertise and the structure to take the burden of LOINC matching off of these organizations. And we have real lab scientists. They've worked in the field for many years, and most of all of them have also worked in the terminology world. So they bring a unique blend of both the clinical expertise and the technical expertise. So know LOINC like the back of their hand. And because they've been doing this for so long, it's incredibly efficient and accurate for them to get to a one-to-one LOINC match for any systems data. We also have physicians in-house that do a final review of LOINC matching, but it's really incredible how quickly the people that have worked in the background with LOINC in the hospital system and the terminology world, whether they worked at Oracle or Epic or Meditech or McKesson, bringing that all together and with the different lab specialties, right? We have microbiologists, we have blood bankers, we have hematologists. They bring a good blend of clinical expertise plus the technical that makes this fast and easy.
Thanks, Dana, for sharing that. And yeah, we do have a great group of folks to help support this workflow that we're really proud to discuss further with the team here. Wendy, I'd like to transition into kind of getting your thoughts on how IMO Health has helped partner with you over the years, starting with, what first led you to decide to implement IMO core procedure at your organization, and what was kind of the impact that you saw from first implementing that?
From the beginning, I was interested in how the tool could better serve us. And so we were very interested in seeing how we could achieve that. So we came up with a case that we wanted to run with you guys, and which was our imaging, all of our imaging orders for multiple imaging locations. And what we did was have you guys map LOINC with those imaging orders so that we could use those order mappings for data exchange with other organizations. And so that was one of the first projects that we did the dry run with the procedure application. And then after that, we're like, well, we're getting ready to implement this new LIS system into our EHR. We might as well get all of our EAP done, even though the project wasn't going to go live for a while, get all of our EAP or our order records and our result records all mapped and ready to go with LOINC. And then with our infection control system that we're also implementing, we wanted to utilize it for the organisms, which was something that was new to you guys and exciting that you guys could achieve that and get those SNOMED concepts mapped at the organism level for us. We've also been working on some other ideas and use cases where we could utilize it to streamline analyst work, because with these mappings and Excel spreadsheets and the on and back and forth and clinical review, it's so much easier to just hand data over to IMO and them to run with it and then present back their findings. It's not 100% all the time. There's a go between, and back and forth, and a relationship that is established in communication and working through some things that stand out, and all of that support and the results that we received were all reasons that we moved forward with the IMO core procedure tool.
That's great to hear. And like you, we're very excited about the organism mapping support and the opportunity to work on that with you. Sounds like from your perspective, there's a lot of different groups and kind of subgroups involved with ensuring that core procedure fits into their workflows, fits their needs. Can you kind of talk through how those groups work together, if you have had different committee meetings, and kind of how to ensure a successful rollout across those different use cases?
Yeah, with with the application or the tool itself, you guys come to the table with a lot of clinical informaticists and clinical folks behind you to help assist with your end of it. but we also have experts on our side that help review everything that was completed and any of those little issues or one-offs that stood out that needed to be resolved. We had, boots on the ground people to clinically review those in the respected areas of imaging or lab, or even the or the organisms, which was another separate person as well.
And thank
Gotcha.
you for
Yeah.
that. That is so valuable when we have the expertise on the client side as well to help us navigate through that. So thank you for that.
Yeah, it would have been impossible if it was just me trying to help you navigate that and I didn't bring the experts to the table.
Yeah, I think to echo on that, what Dana said, it's been extremely valuable, the partnership that we have with your team and the open communication. It helps us help you all better by having that open line of communication and being able to work together in an effective manner. So it's been great. You had mentioned other ideas to streamline analyst work and efficiencies. Have you noticed any improvements in data quality, mapping efficiency, or any sort of kind of metrics in terms of daily analyst workflows that implementing core procedure has provided?
We really haven't been able to measure it for the efficiency yet due to the LIS is not live. That's an implementation that we've been working on for the last 3 years and will be going live in May of 2026. But for the imaging, obviously the biggest thing was the tens of hours that it saved the analyst of trying to map those on their own and then having the reviews, long reviews of all of those. And we're talking thousands of orders. That was the huge draw at first, was that. But having it mapped for the data sharing and being able to not have those things error out because the system can't communicate with another system effectively, obviously has been a big positive.
Great. Yeah, that's great to hear, and we look forward to working with you to measure some of the efficiencies that the organism mapping brings in 2026. I was going to ask you about the organism mapping, but we already got to that piece. But a follow-up question that I had for you, Wendy, is can you talk to how that impacts state regulatory agencies and reporting that's required for that?
I can't go too much into the details because unfortunately I'm not the person that handles that, but it was done also to meet those requirements here in the state of California. So that was one of the other big drivers besides the implementation of infection control, was to have that mapped for a state of California requirement. I'm not sure of the organization, but I can follow up and provide that to you at a later date.
Sure. Yeah, that's great. And even just kind of talking through the state regulatory reporting requirement and how IMO core procedure is able to help assist with that, and we'll be able to help assist Cedars with that going forward. That's tremendous to know about. Dana or Wendy, any other kind of questions or items that you wanted to highlight here before we move into our Q&A section?
I don't think so. Just back to the regulatory, I don't want to mention by name the California state regulatory, but we have heard there's many states coming with regulatory similar in the future. I think New York is next, kind of more on the East Coast, but this is something we're excited about partnering with and supporting. Yeah, let's go to the Q&A and let's see.
All right, so it looks like we have a few that came in. So does IMO Health have members on the LOINC committee that help shape content creation?
Yes, we do. We have a few members at IMO that are actually on the LOINC committee. They regularly attend those meetings and they submit code suggestions to registry if they think, okay, we should probably have a code for this or that to build out new content. And then also every time that LOINC drops an update, which is in the spring and the fall, we also have members on that committee that suggest corrections after that release, whether it's a content error, a spelling error, and we've got a really good partnership back and forth with LOINC registry. LOINC and registry are the same thing, basically. Can use them interchangeably, but we do partner with them very closely.
Awesome. Let's see. What's new and upcoming advancements in LOINC realm has IMO Health prepared for?
Top of mind, the newest things with LOINC. LOINC has been for years now talking about partnering with SNOMED and trying to, SNOMED has a very structured hierarchy. LOINC does not, and LOINC and SNOMED have been talking for years and years on combining. Crosswalk is probably not the best word to use, but as far as aligning their dictionaries a little bit better. So that's something that we're very involved with. IMO has members on the SNOMED committee, the LOINC committee, and we're thinking through how we could merge those two things together and make them mirror each other better. Another thing that LOINC is coming out with is trial codes. LOINC to date has been very specific on the 6 axes for each LOINC code and very specific, very black and white. And they're looking now into making order codes. And this supports what I was just saying about the hierarchy, right? Making an order code that maybe you say, I'm ordering this test panel and here's all the things that fall underneath it. That's a more broad, it goes against what we've done in the past with the very specific pieces of LOINC. But the trial codes did come out in this last 2.81 release, and we are integrating those. We are looking at them. We're excited about those. And one other area I would mention is LOINC answer codes, LA codes. Those are really important for SDOH, any social determinants of health. That gets more into your surveys, right? Are you depressed? Do you use tobacco? Do you use alcohol? And all of the questions you may ask in a clinical setting and all of the answers that may come from that. LOINC has a strong presence there, and that's something that we're adopting here. We're looking at adopting here at IMO.
Awesome. All right. So again, how often does IMO Health release LOINC updates?
So we release in the spring and the fall. LOINC usually pushes out their official in February and August, and then we carefully curate that content. We do that to reflect any changes, any additions, any deprecated codes. That's very common with LOINC to deprecate a code, say that, right, this is in the past, we're not going to use it any further. So we do twice a year.
Got it. A reminder for the audience, just put in your questions in the questions section, should you have any, but it looks like we have a few more. So is there any sort of preview for new codes that might be coming out of as part of the pandemic?
LOINC itself, they do pre-release codes before every scheduled release in February and August. Sometimes, it's a maybe. It's not ever 100% guaranteed that that's going to come out in the official LOINC release, but it's very helpful, especially COVID pandemics. That's a great example to get a heads up on what we might need to build, what we might need to consider. Back in 2020, LOINC, I think, released almost a dozen of those pre-release codes, and that was very helpful to have a heads up on what we need to do with those.
All right, so it looks like that's it. I'm going to go ahead and close out for today. Chris, Wendy, Dana, thank you so much. If you have any questions regarding IMO Health Solutions or IMO Core Procedures, just email sales@imohealth.com, and we'll be sure to follow up with you. Thank you again for spending your hour with us. We really appreciate it. I know there's a lot of other places you can be, so thank you very much. And thanks again. Have a good day.
Thank you, everyone. Take care.